I'm talking to Martin Broby today, who is a licensed child and adolescent psychotherapist in Sweden
Yep.
and a fabulous person. You're going to teach us a little bit about silence and what you know about it as an expert in silence.
All right. I'm the expert. That's good. I wrote the paper with one of my better friends and partner in crime, everything work-wise. Lisa, we work with adolescents here. She had met this quiet adolescent for about 6 months. Didn't say much, would say good, bad, don't know. Lisa was observing the things that are happening with her as a therapist, wanting to help as much as you can. Your own anxieties, your own irritation that this person is coming every week, but it's not responding to anything. And then when they had the follow-up for 3 months, I said, how the session's going with Lisa? And I'm so happy to be able to talk out,
Right.
have someone to talk to. Within the limitations of writing this paper, we focus on what happens with therapists when they meet these patients. So what's out there on silence is quite a bit. And then there was this person called Levitt that identified 3 types of silence as obstructive, neutral, and productive.
Obstructive, neutral, and productive. So I think it's pretty easy to guess what productive is.
If you've got sorrow in your life, processing someone that you've lost, you can sit there quietly and you're together in this connection.
I think it's easy to see when someone's in productive silence.
Exactly. And the neutral silences, the neutral ones is where you might not be getting anywhere, but it's also not a stop in the process. So it just needs to be silent for a period. We were interested in these obstructive, why it becomes obstructive.
Why is it called obstructive?
I think it's called obstructive because there's a temporary or more long-lasting stop in the process. It's obstructing the actual therapeutic process. Therapists go into their own mind and wanting to sort of solve things for the patient. I think the other word to use is stalemate. A lot of therapists that we interviewed 8. They said it's also not static. It's quite often that there's moments of this obstructive silence where you just land in yourself as a therapist and just see, is this really obstructive?
And how often do adolescents engage in obstructive silence?
We found very few studies specifically on adolescent psychotherapies, but in these short-term therapies where they found that 29% of session times was silent. And then in adolescent therapies, 69% was overrepresented of being obstructive.
So a third of the therapy is silent.
Yeah.
And 70% of those silences are obstructive silence.
Yeah, exactly.
Wow.
That was definitely a much larger portion than in adult psychotherapy.
I always say to people that working with adolescents really helps you hone your skills as a therapist.
But it's forward constantly in this changing process. And I think us that choose to work with them, I also think that's the exciting part.
Yeah.
And the frustrating. Subjective experiences for therapists in obstructive silence and adolescent therapies was coming in touch with this. We called it unconnectedness.
Having read the paper, a lot of the effects that you describe are about how important it is for the therapist to get in contact with their own inner self, for want of a better word, or their own inner processes, because it's actually about how you as a therapist process it. All that's going on for the adolescent.
Remember that I'm also psychodynamically schooled. So you've got this interest in what's happening in yourself and then what's counter transference. I think it starts in a therapeutic relationship that you're feeling, oh, now we're no longer connected. An initial stop and then a distance in the relationship over time. And that time varied, of course, that could lead to termination of a therapy, but it could also just minutes within a 50-minute session. And some had over several sessions, which they just give one-word answers or just give, it sort of has the same impact on you as a therapist as on them as therapists.
It's such a closed response. You've got nowhere to go when someone just says, I don't know.
The most comments with it summarized the therapist once they came to the realization that the adolescent is probably feeling this as well. So we actually unconnected both of us from both the process and from ourselves. And then now where it stops, we need to do something different. And we call it experiencing unwanted negative emotions within the therapist.
So you mean like me as a therapist, I'm sitting across from an adolescent who is silent.
Yeah.
And dealing with my unwanted emotions.
Exactly. So what shows up? We were interested in that. So what happens within yourself as a therapist? And we thought it would be a lot more anxiety like, I need to get this adolescent to talk. We interviewed quite a few experienced therapists. I'm talking 10 plus years, and then a couple had worked with adolescents as social workers, but not as therapists, but also had 10, 15 years of experience. But there was a lot of irritation, frustration, and anger if they were honest with themselves.
Well, lots of the work that I do, and because I do ACT work, the models are not dissimilar in that we are looking at what's going on inside us, that countertransference. So it's really hard for therapists to have anger and frustration and to
Exactly
just
right.
feel frustrated with a client who you're
Yeah.
trying wants help and needs.
And exactly. So the second part of that was that once they realized, if they were honest with themselves, that there is this irritation, anger, and frustration, then the shame came. But I shouldn't be feeling this towards my client in the session with the adolescent that needs help. Like I said, I've got 2 cheat notes here. This person, this therapist, had worked quite a long time, and he goes that, remember the teenager, and we both knew what the goals were, and then nothing coming my way in the session. Because I remember thinking, you're such a hopeless person. Like you want help, and nothing's coming out of you. And he goes, so irritated. Until I sort of tried to reestablish this connection later on. And then another person was more towards the psychoanalytical part, and it's not permissible to hate. It's like the same as if you hate being a parent at a certain time.
Yeah.
It's quite a forbidden feeling. And that sort of led to this deeply rooted shame. And you could feel it. Why am I not better as a therapist?
Was it easy for therapists to talk to you about that anger and frustration and shame? Because I spend a lot of time in supervision, and I really try hard to help the therapist reveal everything that happens. Whatever happens to you is normal. You're a human. But it's so hard. I find it's hard for supervisees to say, I felt angry or ashamed or stupid.
Definitely, some needed prompting. When I felt like, okay, are you being completely honest now? I think the one-on-one setting helped. I remember an interview that I conducted. I asked, can you explain a little bit more? I got this sort of looking, that's the part you want me to explain more, my shame. I said, yeah, I think that's really important. That's sort of what you're hinting at. Because, yeah, sure, let's talk about it. Wanted to throw things in the room about how angry I got. More angry or irritated, the more shame I felt afterwards. So
yeah, because you're a trained professional, you're supposed to be able to deal with all this stuff, right?
Exactly. We're supposed to be better at all the solutions.
Basically, when an adolescent is there and not talking, it's as much about what's going on for the therapist. And then it transfers back to the adolescent who we suspect probably know you're frustrated.
Yeah, but you definitely need to be aware of it. And that's in the attempts to then to reestablish a connection. That's when they try to find these factors. Do they know how to speak? Have they not learned the actual way of being a client, so to speak? Are they here because the parents want them to be? Sometimes both adolescent defenses, they call them, and then I think we could pick up maybe there's also some defenses as a therapist. It's your own identity as a therapist, so to speak. But the counter-transference was that you need to be so acutely aware of that. If this is my own anger, if this is an anger or something that's being projected onto me, then am I just going to give this back? Then was much more likely, I think, would lead to therapy failures.
Unconnectedness, negative emotions, and what was the other one?
The headline for me was losing oneself as a therapist.
Losing oneself.
You get these self-criticisms, feelings of resignation, and what used to work no longer does. Like I'm pulling out all my tricks. Again, one of the interviewers saying, I could, I go to a whiteboard. I could talk about something else. Try to find interest that have worked previously.
Get your bag of tricks out.
I was juggling. I was doing everything except juggling and standing on my hands. Nothing worked. And I think we've all had those sessions.
Absolutely.
Well, I have at least.
I have too. I have too. And the shame that I have felt when I have lost a client, and that's happened. But the shame that I've felt, I've lost an adolescent because they're silent and I push too hard, or try too hard, or my magic tricks and singing, dancing show.
Exactly. And we just sort of discussed the therapeutic relation between compared to adults with a therapist was that adolescents wanted to be more like a friend, but a friendlier, closer, relaxed atmosphere. At the same time, they're in identity forming, so they can also misinterpret us as parents, and therefore they're not going to talk to us.
So they're
And
projecting on you a parent figure. Okay.
yeah, I think with adults traditionally there was this view that you can sit silently, that it's not as much of a problem. Here you can really find balance because you're supposed to be more forward leaning as a therapist with teenagers or with adolescents. Um, and then that can be exactly the thing that also pushes them away because you're too much in their faith.
Oh,
So it's a constant, exactly, it's a fine balancing act.
I'm writing down the list. So in terms of people listening, you would say, what do I do with these silent kids? You can't be too much. You need to recognize that they might be projecting you as a parental figure who is authoritarian or authoritative or something like that. You have to be relaxed.
Yeah.
There's no pressure
Exactly.
here, Mark. What else do you have
No.
to do?
You have to be relaxed and leaning forward. You have to respect their space. At the same time, you can't leave them silent for too long. And then if we're going to use the word accept, sometimes just accept that, no, this is just going to be one of those sessions. I don't want to say hope for the best, because that would mean that we're sort of, putting your hand in front of our eyes and just blindly walking and hoping that therapy is going to work out. It's not easy. I think when you meet this obstructive silence. But yeah.
That's exactly what I would suggest to do. But there's one more thing that we talk about in ACT, which is like a core concept in ACT, and that's willingness. I talk to people about the therapist being willing to be uncomfortable. Just being willing to have your stuff and recognize it as your stuff and not your client's stuff, and let that be there. So my inside is screaming, you're a terrible therapist. Someone could do this better than you. And then when I get in that space, I start to do the singing and dancing, which doesn't help.
Exactly. And that was the other word, the other quote written down was that said, low. Like that was a word a lot of people use. That with teenagers, usually you just feel like, okay, we can be a little bit uncomfortable. But if you get really uncomfortable, you really start questioning and losing yourself as a therapist, that's when you start either being really angry and first projecting it onto the adolescent, or the less experienced one, the therapists that are more anxiety based in themselves. They would then just start talking, asking more and more questions. Of course, when we sit here and think about it calmly, of course, none of those two strategies work, but that's what we go to.
I hadn't thought about this phrase, but it seems like what you're saying is that what we do when we're distressed is we begin to try to control the session.
Yeah, exactly.
And as soon as we're in that place
of our terms,
we're trying to control it and make it work, make it flow.
Yeah. And then, some therapists talk about that, the expectation, professional expectation you put on yourself, that you want to succeed with every session and every client, but also that you might be getting paid by the parents that are sitting outside. Why is there no change? Either way, you're not present in the moment and not allowing yourself, what you said, to just be with your own uncomfortableness and with all the things that pop up in your own head.
You said, be relaxed, lean forward, but not too far forward. Don't be like their parent. Don't be too much. Respect their space. Fill yourself with acceptance.
We can maybe add like the private part. What do our own kids say? Don't think you understand me either. And don't think you're a friend either, but be friendly. I don't want one of those stuck-up therapists that just sits there and nods.
Don't make it about you.
Yeah.
Don't make it about, or when you do inevitably make it about you, just be able to be aware of that and let that be what it needs to be.
Yeah, exactly.
Nice. Well, reading it, I was thinking, oh, it's so interesting. I don't think I've thought so much about silence. I've certainly experienced a lot. Well, I don't think I've thought so much about it. And in fact, it's a big part of therapy. There's lots of moves towards different ways of doing therapy where they're looking at AI and looking at transcripts, and you're not going to see silence in these transcripts.
I don't think you'll be able to describe it either. Like,
No.
even if I was to, attempt to really go through what I felt and what they felt, what I think felt like, how 1 minute of silence can feel like 3 hours, and sometimes 30 minutes of silence can be completely comfortable. And I think, yeah, there's something it's hard to describe, to put into words.
Well, it's all about the therapeutic relationship, isn't it?
Mm. And that's what it came down to, yeah. We're talking about alliance, we talk about, like you said, don't make it about yourself.
Yeah.
Um, yeah.
And in the end, I guess there's what you're doing. If you're able to do all those things, be relaxed and lean forward and not do this and too much of that, that you're eventually modeling how to have relationships.
Yeah, exactly. And then we need to, maybe the first step is to be honest with ourselves, at least,
Right.
that we feel this. Of course, it's a therapeutic relationship. It's different from private ones, but yeah, we're still gonna have feelings about it.
Well, I don't know if it's that different, really, because if you think about it, when you make a new friend or start dating, silence is incredibly uncomfortable.
Yeah.
And you're always trying to fill that.
Yeah.
A couple of minutes of silence with a new date is really uncomfortable.
Yeah, of course.
But you're married, or you could be silent for days.
Yes. That's right. He's having one of those days, one of those weeks.
Maybe in a way it'd mirror our relationship.
That's true for the adolescents that you've worked with for a while. They can have, if you want to call them, bad sessions or silent sessions. You're going, I didn't really get anywhere here. And then you can address that in a completely different way the next time as well.
Yeah.
Mm.
Because you've got that attunement.
Exactly.
Yeah. Well, I think we could leave it there unless there's something that you wanted to add.
No, I'm good. It was fun to write because it's such a, honestly, honest subject. So yeah.
And I think really important for therapists to understand, especially people being newly trained. I think they spend so much time teaching them what to do that sometimes these things are forgotten.
Yeah, exactly. And that it's not an incompetency in that sense. It's just, this is something that you might have experienced. I don't know, but at least be aware of. We're not perfect either. But
Thanks, Mark. That's really great. Thank you for taking the time. I really appreciate it.